Well, good afternoon, and thank you so much for joining us on the Global Pain Association's weekend program on chronic pain and ways in which we can address something that affects literally millions of Americans across the country. Right now, folks have been up and awake for a few hours. Many are still struggling with that chronic pain that just doesn't go away. And part of what we do on these weekly programs is bring experts in to talk about aspects of chronic pain, ways in which using non-prescription approaches, we can deal with pain that has affected so many of our lives. I'm Ron Aaron Eisenberg. As some of you may know, I have the pleasure of hosting a number of programs, especially those dealing with medical issues. I do a show on caregiving. I do a show on healthcare for seniors and for their families, and this program as well. So it all fits together, talking about how to make our lives better, healthier, and achieve that quality of life that many of us would like to have. Today's topic on our program is overwhelmed. Are you feeling overwhelmed in the era of COVID-19? Who isn't? Overwhelmed, stressed, how do we deal with it? Well, today's series is brought to you by River City Cardiovascular. They're a comprehensive, independent cardiology practice specializing in the diagnosis and treatment of heart, cardiovascular, and peripheral vascular disease. The doctors are board certified in cardiology, physicians who are licensed in Texas to treat all aspects of cardiac-related illnesses. The practice has 5 locations serving downtown, southeast San Antonio, southwest San Antonio, Alamos Park, and the newest office in Westover Hills. There are satellite offices in Floresville, Pleasanton, Pearsall, and Jourdanton. Now, you can learn more about cardiovascular at our www.rcccvsa.com. And you can find out all you need to know about patient-centered care from River City Cardiovascular. Speaking of patient-centered care, we're going to bring on the actual creator, the driving force behind the Global Pain Association. It was her idea to put it together, and working with some of her colleagues, she has assembled an enormously talented board of directors and have come up with this series of programs dealing with chronic pain. Please welcome Susan Blackwood. Dr. Blackwood is president of the Global Pain Association. And Susan, good to see you again. Thank you for this great idea, helping so many people who struggle with pain.
Well,
what made you do this?
It's great to spend every Saturday with you, Ron, and thank you very much to you and the Eisenberg Group for helping us put this series together. But we knew that people need resources in the community, and we've been reaching out through this virtual series to thousands of people that want to find alternative ways to manage their pain. Their caregivers are loving. We're trying to build a community around them so they have resources, and it's been quite an adventure for the last year and a half.
And as you take a look at what you have put together for folks who want to get involved, you've got plenty of room for help.
Oh, absolutely. Again, we've got a great board and a great advisory council that have been working diligently for the last 2 years, and now it's culminated in this series. But we need all the sponsors and donors that we can get, keep these series and these activities going. And they can find us at www.globalpain.org. And they can donate that same way by getting on our website and www.globalpain org at we're going to run this on the screen. Helping me out, thank you. But we have plenty of chances through that website for them to get on, get involved, donate, volunteer. We have many, many opportunities for them.
In fact, one of the interesting parts, Susan Blackwood, is today's program, Feeling the Impact of COVID-19, is an example of how adaptable you were originally. You had planned to do a series of live programs, the traditional bring folks into a big room, have a panel of experts, talk about issues, a lot of FaceTime, but you couldn't do that in the world of COVID-19.
Well, we had a great event last year in September, exactly what you're saying before all this hit. and it brought a lot of experts and a lot of people with chronic pain together. They enjoyed it. We had great reviews, great evaluations, great sponsors with a lot of recognition. But we pivoted. And in my basketball world, sports world, that's the way that these things happen. And we've had a great response to this as well.
Well, Susan mentions basketball. She is the genius behind bringing the Final Four to San Antonio in college basketball. Men and women, they're still coming, and Susan is working diligently on how to make that happen in 2021. Well, we're going to shift to our guest, Susan. We're going to get you back on in just a short while, and we thank you again for what has turned out to be a wonderful way to help folks. Today, we talk about the emotional impact, call it stress, of COVID-19, and our special guests are Rebecca Christopherson. Rebecca is a registered nurse, a master's in social work, dealing with psychiatric social work, board member of the Global Pain Association, a chronic pain warrior herself, and something we found out in rehearsal the other day, she's a rescuer of any number of dogs who face really an awful life without it. And she has one of her little babies in her lap. So, Rebecca, thanks for joining us. I'm going to get back to you in just a moment with a little Q&A. Let me introduce now Dr. Jennefer Sutton. She is a board-certified family physician and a primary investigator for Victorium Clinical Research. She's a PCP out at Randolph Brooks Credit Union out there at 35 and 1604, where there is no traffic, no problem getting in and out of that facility. And Jennefer, we're so happy to have you with us. I want to start with you, if I may, and then we're going to, let me start with Rebecca, and then we'll come back to Jennefer. Rebecca, you've worked a lot in the medical world. You have worked with patients who are struggling with psychiatric disorders or issues that are affecting their lives. What got you involved in the whole question of global pain?
Well, it's an interesting question. I used to work at MD Anderson Cancer Center as a grief therapist and then medical ICU. And then that prompted me to want to be an ICU nurse. So I pursued a BSN and had planned on working forever. Unfortunately, in 2008, I was diagnosed with a disorder called reflex sympathetic dystrophy or partial complex pain syndrome, which on the McGill pain scale, which is the standard pain scale, it's the most horrific pain you can have. And it was as a result, unfortunate result from spine surgery. At the same time, I was experiencing a lot of fatigue and joint pain. And we lived in the Pacific Northwest, and I thought, well, it's probably just the weather. And when I moved here, I was fortunate enough to meet with a pain doctor who diagnosed the RSD, Dr. Ellen Lynn, and then she sent me to a rheumatologist just to rule out any autoimmune disorder. Unfortunately, he called us that evening and said, you definitely have lupus. And so I have, some pain from that. So I'm both a therapist, the ICU nurse, and a chronic pain warrior, as I like to call myself.
And you have, like many of us, been self-quarantined at home. For those who are watching this, who may have been climbing the walls, who are feeling so stressed, so anxious, who just want to break out and run down the street, I can't take it anymore. Tell us what the signs are that we are stressed, need to deal with it, and perhaps need to understand why we have to self-quarantine.
Okay, well, it's very important. It's in our nature when we are feeling anxious or depressed or something is bothering us. It takes a long time for it to come to a head in our conscious part of our brain to realize something's not quite right. And I had quarantined with my daughter at her college apartment in Waco because my husband's a physician and he felt with my immunocompromised state, I needed to go. Well, I thought I was functioning well. and getting organized, doing everything. And then I found myself feeling anxious. And I spoke with my mother-in-law and I said, is this getting to you? She said, oh, do you feel like you're making lists and lists and then you just run around in circles and don't get anything done? I said, exactly. And so I realized I was very overwhelmed. I missed my home, my family, the rest of my family, my husband, my son, and my buddies here. And so I thought it was a very good topic. So some of the signs are, if you have a change in appetite, if you're eating more or less, if you're sleeping more, or you have you're unable to sleep. I was unable to sleep. The other thing is if you smoke, if you use cigarettes or you drink, if that increases. Oh, there's an alarm going. So bye. If you have difficulty concentrating or focusing, I noticed that I love to read. I'm an avid reader of nonfiction and historical fiction, and I would read the same paragraph over and over again. So it's an inability to function. I thought, what's wrong? There's nothing wrong. I'm sheltering in place. But I think the effects of this pandemic was bothering me. And also, with those of us with chronic pain, we have other morbidities. We have chronic health conditions that predispose us and put us in the high risk group for COVID-19. So that's right in the back.
Let me ask you, pardon me for interrupting, but let me ask you, knowing this, that you're like a hamster on the wheel, going as fast as you can, but getting nowhere, waking up at 2, 3, 4 in the morning, can't go to sleep, not reading, not eating or overeating, what have you. What do you do about it? How do you address that once you have those facts?
Well, this sounds very simple, but it's very useful, and therapists have known about this forever. Instead of letting that stay in your head, going around in circles, it's very cathartic and very therapeutic just to say it out loud to someone who cares about you. I express my feelings to my daughter and then to my husband on the phone. Just the act of putting it out there in the universe rather than keeping it all bottled up. Humans tend to withdraw when they have negative feelings. I do the same thing, even though I know it's not healthy. So at first I did that. So just put it out into the universe. The next thing is I would limit the amount of news, you're watching, and only use reliable sources. We're getting so many mixed messages that adds to the anxiety, because if you have information, then you can plan. But if the information you're getting two different, it's coming from different sources and it doesn't all jive together, then that adds to your anxiety and feeling of overwhelm. So I would recommend following the CDC website or the World Health Organization website, and your local county and your mayor officials. The other thing is, but limit what you're doing. And the other thing is, find something that brings you pleasure that doesn't require a lot of concentration. I could not read. Well, when I was in Waco, my roommate from college from 40 years ago, she had sheltered in place for 2 weeks and we had 2. So we went out, she was working from home. Well, she taught me how to sew a mask. She loaned me a sewing machine, and I'd never sewed in my life. I found it was like, for me, like pulling weeds. Get your mind off. It's very therapeutic. Or gardening. Gardening is another thing. But I started making masks, and it was something I could focus on that I wouldn't get distracted, and it was very therapeutic. So whatever it is that brings you happiness, if it's gardening, knitting, going for a walk, in your neighborhood while social distancing,
and wearing a mask.
Meditation, whatever it is that brings you peace and get your mind off the fact that we're in a pandemic, use that. The other thing
All right, now,
yes.
Rebecca, you've given us some great things to think about. We'll let you settle that dogfight that apparently is going on in the hallway outside of the room that you are sequestered in. And we're going to come back to you in just a moment. I'm going to bring Jennefer Sutton in. Dr. Sutton is the PCP, also a researcher, and has done a lot of work on a variety of issues. And Jennefer, let's start with what is the easiest and toughest one. And that is, if you are so afraid to go out and we're being told, isolate, but you need to see your PCP, how do you make that happen?
There are a lot of ways to make that happen, and we had to scramble to do.
Now we've lost Jennefer for just a moment here.
Oh no, I'm back.
Got you back.
There's a number of ways, as I was saying, that you can see a primary care physician, but I think the newest and most important way is telemedicine. Just like this, you can be in your living room, wherever, and you can hook up with your family doctor, with your specialist, to be able to have that visit. If you don't have something that is life-threatening, something that is not horribly complex, or needs something with hands-on care, you can see your doctor, and your doctor wants to see you. Believe me, I have been sitting in my office some days just hoping somebody would call, because this is what we do. We care. And so we still want to see you, but we can do it safely.
Well, we'll put your number up. Call Jennefer. With the stress that's involved, and as we heard Rebecca lay that out, for folks who haven't dealt with these kinds of issues, much of what she talked about sounded like, to me, and I'm not a doctor, depression, that she's dealing with many of the characteristics that we define as depression.
Absolutely. It's an acute reactive depression, that lack of motivation, that inability to concentrate. Some people with depression or anxiety even think they're having dementia. We call it a pseudodementia, because they can't remember things. They can't focus on a task. They can't complete things. And yes, it absolutely is.
So what do we do about it? For example, there are days I wake up and I don't remember, is it Monday, Tuesday, Wednesday, Thursday? Drives me crazy.
Yes, absolutely. So trying to come up with a pattern, trying to make it so that you have something that you do every day, even if you're not leaving the house anymore and going to the office, trying to come up with a normal routine. I mean, we do that with kids when we're trying to get them back to school. We start them waking up on a certain time and getting ready, so they're ready to make that transition. Well, we need to do that to adults as well. I think one of the other important things we need to do is understand there are things that you can control, and there are things that you can't control. You can't control what your neighbor does, whether they wear their mask, whether they're doing what they're supposed to do. But you can control what you do. You can turn off that news program that's upsetting you. You can disconnect for a while from some social media that may be toxic. You can wear your mask. You can socially distance. But you have to let go of the things that you can't control.
Now, talk to us for a moment about masks. And I'm thrilled that Rebecca has opened a mask production company. Never in my life have I seen something that is so useful, so easy to handle, become such a political football. As an aspiring doc, you got your white coat day when you begin your work as a medical student. There was a day they gave you a mask. Nobody thought about it. You wore it. But today, it's become a symbol of I don't know what. Why are masks important, first of all, Jennefer?
Well, it is unfortunate that it's become, so political. This is public health. Public health and science is not political. It's what it is. Masks are important, it's not protecting you so much as it's protecting everyone else around you. If I cough and sneeze, then I'm spraying all those particles out all over you. If I have a mask on, I'm containing that in. If you have a mask on, you've got that extra layer of protection. I think that there was some problems with the way the messages came out at first, where the CDC said it wasn't helpful and then it was helpful, that allowed some misgivings and some miscommunication to occur.
And your recommendation is wear the mask.
Wear the mask. It's not that big of a deal. Get a cute one, get a mean looking one, get something with, I made one for my husband that has cowboys on it. Do something that brings you joy. Make it part of your style. Find a style that fits you too. I've seen so many people that are pulling on it, pushing on it. They can't wear it appropriately. Keep on trying until you find one that fits your face. It's not one size fits all.
And you have a tip for those of us who wear glasses that can make wearing a mask easier. I know the first time I put mine on, and I have reading glasses that I use from time to time, more often as I get a little older, they fog up when I put that mask on.
Yeah, that is one of the biggest complaints that I get. And there are a lot of things like putting anti-fog on your glasses, maybe taping your mask down. But this is the easiest one I found because you can see I've got glasses. So this is my mask, one of them. If I put a mask on and I have my glasses above it and I breathe, I fog up.
Ooh, you fog up.
Yeah. So if I just bring the mask up a little and I put my glasses down just a little bit, no fog.
Wow.
So just wear it below your mask, not above, below. And it fixes it right up and it makes life a whole lot easier. Now,
as a young med student, did you discover that early on, or is this a recent discovery?
This is sadly a recent discovery. In medical school, you had to tape your glasses to your forehead before you went into an OR, so they were far away from your glasses, far away from your mask, so it wouldn't fall into the surgical field. So I didn't feel like walking around with tape on my forehead for several months.
Now, before we say thank you to both of you, I'm just curious, in 30 seconds or so, we'll start with Rebecca. Something we haven't asked you want to share with us as we look at the stress of global pain and the stress of COVID-19.
I think another thing that's important is to point out that anxiety over a prolonged amount of time will eventually turn into depression because you begin to feel hopeless. And when you're anxious, cortisol is released and your body is in overdrive, fight or flight. Eventually, it will go into depression. So it has to be dealt with. The other thing I'd like to point out is that therapists, psychiatrists, psychologists, whichever you prefer, are also doing telemedicine. So you can FaceTime or Zoom or whatever platform they use with a therapist, because it also helps to speak with somebody objective. Like I know when I tell my children things, they kind of go, yeah, right, blah, blah, blah. But then they go and see someone in authority and they say the same thing. And then it's like, oh, that was very helpful. So just speaking to somebody in an objective is very helpful. So you search that out while sheltering in place.
That's a great tip. And let's see what Jennefer has to add as the one thing we missed in talking with you.
I don't know if it's been missed, but I just like to reiterate, reach out for help if you need it. There's a million sources for help. If you need to talk to your family doctor, call your family doctor. If they need to bring you in, they'll bring you in and they'll be able to do it in a safe environment. Just let people know how you're feeling, because you're not the only one feeling that way. I can promise you, we've all had times of feeling overwhelmed, every last one of us. Just reach out. And even if it's a virtual hug, it's still something.
Well, thank you. And here's a virtual phone call so you don't feel unloved and so lonely. Well, thanks to both of you, Jennefer and Rebecca. That was really great. And I want to thank you for being part of our series right here for the Global Pain Association. By the way, we're coming to you every Saturday at noon through the rest of June, July, and August. And I want to remind you that the education series you've been watching was presented by the Global Pain Association. As we are here each week, we will have a different topic for you to learn something, I hope. Also want to thank the River City Cardiovascular folks. River City Cardiovascular, they are our underwriter for today's program, and they are very much a part of what we do. They're a comprehensive, independent cardiology practice specializing in diagnosis and treatment of heart, cardiovascular, and peripheral vascular disease. All their doctors are board-certified cardiology physicians licensed in Texas to treat all aspects of cardiac-related illness. The practice has 5 locations serving downtown Southeast San Antonio, Southwest San Antonio, Almost Park, and the newest office in Westover Hills. They also have satellite offices in Floresville, Pleasanton, Pearsall, and Jordanton. So remember, you can learn more at www.rccvsa.com. Well, let me bring back the founder and guiding force for the Global Pain Association, Dr. Susan Blackwood, and get a sense from Susan as you take a look at those of us who are feeling overwhelmed by COVID-19. I think both Rebecca and Jennefer provided a lot of tips for us, Susan.
That was an amazing presentation, Ron. I learned so much from listening to both of them, and it'll be things that I'll be able to use daily, as well as I hope people that have been watching today will be able to take from this as well. And I want to thank the sponsors of this event. Certainly, they have sponsored us since day one, since we started in 2017. And River City cardiovascular folks are just very dedicated to not only chronic pain and all of the people that they treat. And I want to thank the Eisenberg Group for, again, putting this series together. You guys are brilliant. You're a great moderator. And we'd love to hear from people on our website at globalpain.org. And if they want to donate, they can get on our website, globalpain.org/get-involved/donations. And every little bit helps.
And Susan Blackwood, you are a big booster of our guest for next Saturday, June 27th. Beryl Bender Birch, author of Power Yoga and Beyond Power Yoga, founder of the Hard and Soft Yoga Institute, will be with us. And you were mentioning that she is really a national treasure.
I'm excited just talking to her on the phone, so I can't wait till next week. And I think she's inspired a lot of people in San Antonio that are also part of the yoga community, because they're the ones that actually suggested that we get her on. And the other thing I'm very proud of is our board voted last week to keep the series going through July and August. So we have got many more topics that are going to be of interest to people that have been watching. And
if folks want to suggest a topic, info@globalpain.org. That's the email address. Send it on, and we will certainly take a look at it. Susan Blackwood, thank you. A reminder again, Beryl Bender Birch, author of Power Yoga and Beyond Power Yoga, our guest next week. She's founder of the Hard and Soft Yoga Institute, and she will kick off next week's continuation of our series from the Global Pain Association on chronic pain. I'm Ron Aaron Eisenberg. On behalf of the Global Pain Association, thank you for joining us. We'll catch you again next week right here on the Global Pain Association Facebook Live and internet pages. See you soon.